Hi guys, welcome to this channel. My name is Dr. Araoye and I'm your guest for today. In this video, I'll be sharing common experiences that a foreign trained medical graduate may or will experience during house job in Nigeria. Starting, I remember traveling from Abuja to Kaduna and then getting to Kaduna, doing all the hospital runarounds, registering, all that. And then finally I was signed. You're going to Obs and Gang. I took my paper, went to the department. So I said I'm the new house officer. So starting here, it's very hard. It's very hard. Let me not even lie to you. It's very hard. I have a video after my first day. I thought I was going to die. I actually thought I was not going to make it. I actually thought I was going to quit medicine and just stop. Yes, starting is very hard. My first day was very difficult. They because when you start a new rotation or as a new person, when you come to the hospital, you spend 7 days at the hospital without going home. You spend 7 days in the hospital, you don't go home. So it was very hard. I didn't even think I would spend 7 days in the hospital. I really thought I would quit. So after the first day, we had to stay awake all night with all these pregnant women that were in labor. And then when it was around 4 or 5 where they had given birth and we were about to go to bed, then this woman just comes in with ruptured ectopic pregnancy, and I'm like, wait, which is an emergency if you know anything. Ruptured ectopic pregnancy is an emergency. And then we had to resuscitate her. She was on a wheelchair. We had to set lines, put in this. It was very confusing from there, rushed her. And I was like, is this how my life is going to be? I'm from the soft life, coming from Ukraine. I didn't think I would survive. So starting is very hard. It's very hard. And I had a lot of friends because I started my house job in April. I had friends who started after me and they called me to also tell me that, yo, how did I survive like I should? So yes, let me just prep yourself. Be mentally prepared. In fact, yes, be mentally prepared. Be spiritually prepared as well, of course. Be mentally prepare yourself for the worst. Like pastor said, just prepare your mind. Everybody knows our job in Nigeria is slavery. Prepare your mind to be slave away. You'll be under stress you've never experienced before. It will be a very new experience for you. Responsibility, expectations from yourself, from your parents, from your superiors, like I said, from your patient. Oh my god, from your patients, they are counting on you to save their lives, to help them through whatever health challenge they will be going through. Yes, so the first few days is very difficult. And I found out from personal experience that it was not just in that first department. Anytime I go to a new department, I find it the first few days of adapting and acclimatizing is always difficult. So it's normal, you'll be fine. Just start. The first challenge I'm going to talk about is the imposter syndrome. So when you graduate from, let's say, Ukraine, Hungary, Russia, wherever you'll be graduating from, let's assume it's not the UK or the US, and you go back home, there's a deficit, or you feel kind of like you're not a doctor, or you don't have the skills, or if something happens and they actually call me, what am I going to do? Because I had that experience. I was at the hospital after the MDCN exam. Sorry, I was at the hospital for 1 month. I was trying to get some clinical skills before I started house job properly, but it was not very easy. I was at the hospital, but thankfully I had a very good supervisor that put me through. But even in spite of that, I still had a lot of doubts. I had a lot of self-doubt. I didn't think I could do it. So that's the first challenge, and you need to get over it as soon as you can. So the second problem you'll encounter is your clinical skills. Yes, so, and I think it's also related to the first point I gave, because you feel like you have deficit. So if you're coming from Ukraine, particularly if you're coming from my school, or whenever I meet graduates from Ukraine, I already know the kind of deficit that they may have when it comes to having clinical skills. And in house job, you'll be required to take samples, set lines as a staple. Like, that is what everyone is going to expect of you. You should be able to do that. And coming from me, I had never set line before graduating med school, and even after I tried and failed many times. But as soon as I began house job, I was able to do that because I had good teachers who were able to put me through. Yeah, so your clinical skills are going to come into play when you begin house job. A lot of people are going to expect you to be able to do a lot of things, you know, especially the nurses and your superiors, your medical officer, your resident, your consultant. They'll be expecting you to have these skills, and if you don't have it, it calls your it, and that's what even makes them ask the question, where did you train? You know, that very annoying question. Yes, so your clinical skills, that is the second issue you will have. The third thing is how to carry yourself as a doctor. So this is just basically down to your personality. So how will you relate with your fellow house officers? How will you relate with nurses, the people you'll be working with? How will you relate with health attendants, lab attendants, pharmacists, your superiors, patients? So all this one is down to personality. You might find it tricky at first because when you come into the system as a new doctor, and you know, in that department, if you're in a teaching hospital, there will be people, nurses, matrons who are the age of your mother or even your grandmother. They have been there for a long time, and if you know anything about the medical world, doctors are placed higher than nurses, and the matron is the head of the nurses, basically the controller of the ward. So as a doctor, young doctor that you are, maybe in your 20s, this woman is probably in her 60s or 50s, late 50s. She is still supposed to take orders from you, and you that are green as what, you know, you don't know what you are doing. So learn how to carry yourself in that period of ignorance, because trust me, it's going to be a learning curve. As a young doctor, when you begin, you will be learning from the nurses, and at some point, your knowledge, your skill will overtake them because you have better training, you have better knowledge base, basically. But you know, when it comes to the handy things, the menial things, they will be better because obviously they've been doing it for a long time. So learning how to carry yourself, don't give away too much. Now, I'm not saying you should be pretentious and pretend. If you don't know something, please ask. Oh my God, ask. Please ask. You know, I started my rotation. My first rotation was O&G, Obs and Guy, and in my unit or in my center, house officers are mandated to do episiotomies. So episiotomy is basically when a woman gives birth, she might have vaginal tear or whatever, and then you as the doctor, you're the one to suture it. So it was a very tough, in fact it's very tough. So I didn't know how to do it. I asked my superior to show me. He showed me once or twice, but I still didn't get it, you know. Sometimes, in fact, that's another point. I was, at first, you may not get it. In fact, let me show you 10 times, you might not get it, but keep at it, you'll get it. So don't feel bad if as many tries as it will take, just keep doing it. So there was a nurse who showed me how to do the episiotomy, and after some time I got better at it, but obviously she's still better at it. But what I'm trying to say is learning how to carry yourself through your period of ignorance, and even when you become better than them, is very important. So another common problem that a lot of people face when they go back home is victimization by superior officers or superior medical personnel, which is very common, especially if you graduated from outside the country, and especially if you graduated from Ukraine or China or Russia. You know, we already have a bad name. Please don't go and make it worse. Thank you. So yes, so if you graduate from this country, Hungary, don't worry. All the countries I'm calling, if I don't call your country, if it's not UK or US or Canada, you are included. Caribbean, you are inside. As long as you didn't graduate in Nigeria, you are most likely going to be victimized. Even those that graduate from Nigeria get victimized, talk less of we. So thankfully, I have not yet experienced that, but I have people who are dealing with it, and I had people who had spoke to me and told me that it was like these people were out specifically for them, like they had a superior who was constantly breathing down their necks. And so, you know, the truth of the matter is you just have to stand up to such people. You stand up to them politely, because those people can make your life a living hell. You stand up to them politely, and of course you have to pray about it as well, honestly. and then do your job. Do your job. If you do what is expected of you as best as you can, you give them little or no chance of victimizing you or bullying you, you know. Yes, so yeah, that's all. I can't say much about victimization because I have not been a victim. Okay, we've come to the end of this video, and I hope you enjoyed it. And if you did, please like, share, subscribe, and comment below if you have any questions. If you have any questions for me, please comment. And if you are my fellow house officer or my senior and you agree or disagree, or you have something or something I said you don't agree, please also comment below. Click on the video on my right, which is your left. Click on this video if you want to know what you should do during your clinical years, so that you have a better chance or better experiences than I did. And on the left, there's another link to another video, so you can hear about my MDCN experience, my experience post medical school. Thank you.